Okay, so moving right along, we are moving into Chapter 7 of the RX Prep Read to Me series. This is the 8th edition California Law Summary for CPJE. Chapter 7, Controlled Substances, Part 3. Prescribing and Dispensing. Healthcare providers authorized to prescribe controlled substances. A prescription for a controlled substance for a legitimate medical purpose may only be issued by a physician. A physician might be a medical doctor or a DO, a doctor of osteopathic medicine. A prescriber might also be a dentist, a DDS, or a DMD. They might also be a foot doctor called a podiatrist or a DPM, a doctor of podiatric medicine. They might also be a veterinarian, a DVM, a doctor of veterinary medicine. They could also be a mid-level practitioner, MLP, or they could be some other registered practitioner who is authorized to prescribe controlled substances by the jurisdiction or state in which they are licensed to practice. They may be registered or exempt from DEA registration. They could be a registered practitioner who is an agent or an employee of a hospital or an institution, and they're acting in the normal course of business under the DEA registration of the hospital or institution. So all of these types of prescribers are healthcare providers, and they can prescribe controlled substances independently within their scope of practice. Mid-level practitioners, or MLPs, they must prescribe under a physician-directed protocol. The specific medications they are authorized to prescribe will vary depending on the agreement with the physician. Naturopathic doctors have limited independent prescribing authority. For example, natural synthetic hormones, epinephrine for anaphylaxis. If they have a valid drug furnishing and a DEA number, they may prescribe Schedule 3 through 5 under an agreement with a physician. See the Pharmacy Practice Part 1 chapter for additional information regarding prescriptive authority. So again, who are the mid-level practitioners that might be prescribing? They might be nurse practitioners, they might be physician assistants, again, they might be naturopathic doctors. Let's see, controlled substance prescription requirements to remind everyone. We have the topic of, obviously, they have to have a valid DEA number. So each DEA number is unique and assigned to the individual provider or to the institution they're prescribing at. The DEA number permits the individual to write for controlled substance orders, and it authorizes the institution to order and manage controlled substances. So each DEA number is randomly generated, and it consists of 2 letters. The first letter usually indicates the registrant type, like M would mean it's a mid-level practitioner, like a nurse practitioner or a physician assistant. P might mean that it's a some type of a manufacturer or distributor. If the first letter of the DEA number starts with like the letter A, B, F, or G, it could mean that it's the doctor, it's the pharmacy, the teaching hospital, the clinic, the hospital. And then the second letter would be the first letter of the prescriber's name. After those first 2 letters, there's a series of 7 numbers. The last number in the sequence would be the check digit. Some practitioners who were previously authorized under Data 2000 to prescribe narcotics such as buprenorphine for opioid use disorder have a Data 2000 waiver, which is a unique identification number. This number is the same as the practitioner's DEA number, except that the letter X replaces the first letter. For example, the Dr. Wendy Clark, MD, is assigned the DEA number AC 2143799. A is the initial letter representing that she's a physician. C is the first letter of her last name. If she obtained the Data 2000 waiver under her unique identification number, her DEA number would be XC 2143799. Prescribers in a hospital or other institution, including medical interns, medical residents, and visiting physicians, can prescribe medication under the DEA registration of that hospital or institution. The hospital or the institution will assign a specific internal code number to each practitioner authorized to prescribe. The internal code number will follow the last number of the hospital's DEA number. A hospital's DEA number might be, for example, AB1234567. A resident is assigned the internal code number 012. So then the resident's DEA number would be AB1234567-012. This would be their DEA number when they prescribe controlled substances. So how do we determine if the DEA number might be valid? So there's a little recipe here to do the digit check. So the first step is you can add the first, third, and fifth digits. And then you can add the second, fourth, and the sixth digits. Step 3, multiply the results of step 2 by 2. Step 4, add the results of Step 1 and Step 3. The last digit should be matching the last digit of the DEA number. There's a practice exercise. Corresponding responsibility and red flags to prevent diversion is the next topic. So we get into corresponding responsibility, then we get into utilization, review, and evaluation. In order for a prescription to be considered valid, it must be issued in the usual course of professional treatment for a legitimate medical purpose. The condition being treated must be one that the prescriber would be expected to treat. So we have a corresponding responsibility to ensure a controlled substance prescription is valid prior to filling it. A pharmacist is not required to dispense a prescription if there are any concerns about its legitimacy. If we dispense the controlled substance prescription suspected to be issued for an illegitimate medical purpose, then the pharmacist and prescriber could be prosecuted. So we have to be aware of any potential red flags when filling these controlled substance prescriptions to help prevent drug abuse and diversion. See examples from the NABP and the California Board of Pharmacy in the study tip on the following page. Secure storage for patients for scheduled drugs. Many drugs that are used illicitly, including opioids, are stolen from another family member. So community pharmacies that dispense Schedule 2, 3, and 4 drugs must have medication lock boxes or med locks available for purchase. The product should have a locking mechanism like a password or key and be displayed near the pharmacy. Pharmacies where a licensed pharmacist is the majority owner and manager of no more than 4 pharmacies are exempt from that law. Controlled substance utilization review and evaluation system. The controlled substance utilization review and evaluation system, or CURES, is California's prescription drug monitoring program. Prescribers and pharmacists can access CURES, the utilization review and evaluation system, to review all Schedule 2, 3, and 4 drugs that were prescribed and dispensed for any given patient. A prescriber can request from cures a list of all patients that have designated them as their prescriber. A patient can report lists. A patient report lists all scheduled drugs the patient has received, the prescribers, the dispensing pharmacies, and other dispensing information. Each pharmacy has to submit dispensing data for Schedule 2, 3, 4, and 5 drugs to the Controlled Substance Utilization Review and Evaluation System within 1 working day after the prescription was dispensed. All California pharmacists with active licenses must be registered to access cures. Prescribers must check cures to review the patient history for the past 12 months before prescribing Schedule 2 through 4 drugs. So it's like our PMP, the prescription monitoring program. Cures is like it's like the PDMP or PMP. So again, prescribers must check cures to review a patient's history for the past 12 months before prescribing Schedule 2 through 4 drugs for the first time, and at least every 6 months thereafter. Pharmacists are not mandated but highly encouraged to check it before dispensing. Yep, so prescribers and pharmacists are supposed to check. But pharmacists are not mandated. They're just highly encouraged. I wonder if it's because the pharmacies are so busy out here. I don't know. A practitioner must review a patient's history in the cures database no earlier than 24 hours or on the previous business day before they might prescribe, order, or administer a Schedule 2 through 4 drug for the first time. And then every 6 months if the drug is still being prescribed. There are some exceptions. For example, a cures review is not required for veterinarians. The next topic we're going to get into is looking at valid controlled substance prescriptions. We're going to look at written prescriptions, e-prescriptions, oral prescriptions, faxed prescriptions, out-of-state prescriptions,